Good morning, I'm Kim Nelson and I am going to be doing a presentation on fetal scalp electrode. We're going to go ahead and discuss the indications, contraindications, and potential risks. We're going to demonstrate the placement of an FSE and the removal of an FSE, and I'll go over how to complete the competency validation on your unit. So let's start with the indications. Placing a FSE is actually the most accurate way to assess a fetal heart rate when you can't obtain a continuous fetal monitoring tracing. If you have an external monitor in place and it's recording continuously, there's really no need for an FSE because there's no clinical difference in data interpretation. Remember, this is an invasive procedure and needs to be used when the cervix is dilated at least 2 to 3 centimeters. The membranes have to be ruptured, and maternal position changes does not alter the ability to assess the fetal heart rate with an internal FSE monitor. And again, this really should only be used when continuous recordings are indicated and they're unable to be obtained with external monitoring. Some of the contraindications to placing a fetal scalp electrode include placenta previa, suspected or confirmed hemophilia, seropositive HIV women, herpes simplex virus, face presentation or other fetal parts other than the scalp. Really, we don't want to place the FSE on the fetal face, fontanelles, or genitalia. The buttocks can be used, but it's not of preference. And this is not really recommended for maternal infections such as group B strep, hepatitis, syphilis, gonorrhea, or any other non-listed, non-treated sexually transmissible diseases. Again, these are not recommended unless the benefit clearly outweighs the risk. Some of the potential risks include infection, the maternal and neonatal infection. There is a potential to enhance the transmission of HIV. There's a potential for fetal hemorrhage or injury, and this may record a maternal heart rate in the presence of a fetal demise. Now we're going to go through step by step of a FSE placement. I'm going to go over the competency validation, and then there's a YouTube video where you can actually watch the demonstration. First, we want to identify our patient, the procedure, and our equipment. So we're going to introduce ourselves, explain the procedure, gather our equipment, wash our hands. We want to make sure the patient is positioned for a vaginal exam, open up our FSE, and put our gloves on. We do want to inspect the FSE for integrity. That includes the electrode at the end of the cap. As you can see, it's highlighted in yellow. That is a little spherical wire that will actually screw very lightly into the fetal scalp. It has a inner tube and a guide tube, has a connection piece, and it has the cable which is locked in a little slit on the cable lock. When we get ready to place the electrode, the FSE in, we actually want to pull the electrode back into the guide tube so that it does not extend beyond the end of the guide tube. That way it prevents any potential vaginal injury. Starting with the application, we're going to go ahead and have our electrode pulled back into the guide tube. We're going to do our vag exam and assess for the presenting part. Again, we want to make sure that we avoid a fontanelle on the scalp. We're going to maintain our 2 fingers in that target area and place the guide and slide the FSE in between our 2 fingers with a little bit of pressure on the fetal scalp. And then we are going to turn clockwise 1.5 turns or until resistance is met, the lock, and then we will start the verification process. We do want to check the placement and verify it is in place. So how we do that is we're going to flip the cable through the lock. So we're going to unlock the cable, and then we are going to very slightly tug on the cable to make sure that the FSE is in place. We don't want to remove the guide, and we don't want to remove our fingers until that is done, just in case we need to move it. Once it is in place, you can remove the lock and drive tube and then remove the guide tube all in one. We're going to attach the end to the monitor that will be on the patient's leg, and we're going to verify the fetal heart rate on the monitor. We document our placement in the electronic medical record. After delivery, or in the event that the FSE needs to come off and either be replaced or can go back to external monitoring, we want to make sure that we remove it safely. In order to remove the FSE safely, it's actually a rotation counterclockwise at the base where the clip and the electrode meets the fetal scalp. We don't want to pull the electrode from the fetal scalp or cut and separate the wires to rotate the electrode out of the scalp. We actually want to put our fingers in either via vaginal exam or when the baby's head is delivered and unscrew at the scalp. We do want to document the removal and that the electrode was intact. This is the competency checklist that will be located in your LMS. Go ahead and print out the checklist after completing this online module and watching the YouTube video. And on the unit, you will demonstrate the techniques and have a validator sign you off. Once you've completed all of the steps, you can turn it into your clinical educator. Here's the YouTube video. I hope you enjoy the demonstration. Thank you for your time. This is the process for the application of a fetal scalp electrode on a fetal head. When we first enter the room and we decide that we're going to put a fetal scalp electrode on, we explain the procedure to the patient and we wash our hands. We're going to make sure that we have our supplies at the bedside and we have a pair of gloves. The supply is the fetal scalp electrode. It comes in a package. We're going to open up the package at the patient bedside, make sure the patient is prepped and in a position in order to place the fetal scalp electrode. Going to open up the package. We are going to put our gloves on, and then we're going to inspect the fetal scalp electrode. We're going to make sure that the integrity is good, that it's locked, and then we're going to pull the wire back in the sheath just a little bit in that guide, because if we enter the vaginal canal with the electrode piece, we have the potential for scraping the vaginal wall. So we're going to slide that back a little bit. Now that we have our fetal scalp electrode ready, we're going to go ahead and insert it. We're going to take our dominant hand, or whichever hand that you do a vaginal exam with. We're going to do the vag exam, find the fetal head. We're going to make sure that we're going to go on a part that is not a fontanelle, that is not a buttocks or a foot or any other anatomy. We're going to put our fingers there, just like this, okay? We're going to slide through our two fingers until we reach the fetal head. So it'll look like this. Just slide. Okay. Now it has a little bit of pressure against the fetal head. So now that we're in our position, we're going to take our lock, we're going to push against the fetal head, and we're going to turn it clockwise, just about 1.5 times, or until resistance is met. And if you can see, resistance is met when it turns back like that. We're going to unlock it, like that. We're going to test it, pull very slightly, so now the electrode is in place. So I can go ahead and I can pull the guide and the sheath out. And as you can see, it is attached to the fetal head. So you can pull this out of the vaginal canal now. You're going to take the end, you're going to hook it up into the cable, and then you're going to make sure that you have the accurate fetal heart rate. Once you have that in place, you can secure it to the leg, and then you can continue on and do your documentation. In order to remove the fetal scalp electrode that is on the fetal head, it is going to be a counterclockwise turn. So we're going to take it, we're going to do counterclockwise, and then it comes off. We always want to make sure that the tip is intact and document that. When you do the removal, you can do it while the baby is still inside. You would just do a vag exam, same thing, and with your two fingers, twist counterclockwise. You don't ever want to turn or separate these and pull. That twists it kind of a little hard and can damage the baby's head. So it's always going to be a counterclockwise for removal. Thank you for your time, and the references are located on the next page in case you need to look any information up.